For the benefit of those in the audience who haven't come across your work, maybe do a general introduction to yourself, starting from the beginning,
Oh,
and then,
absolutely.
yeah, give an overview.
Absolutely. Okay. Well, I'm Norm Shealy. Officially, I guess I'm C. Norman Shealy, MD, PhD. I finished Duke Medical School, took a residency in neurological surgery, and served on the faculty at Western Reserve, University of Minnesota, University of Wisconsin. And in the mid-60s, I got interested in finding an alternative way of controlling pain without damaging the nervous system. So I introduced something called dorsal column stimulation. We actually implanted a pacemaker-like device over the spinal cord and controlling pain, but also transcutaneous electrical nerve stimulation. And what I found is the vast majority of people with chronic pain were not candidates for the surgical procedure because they had so many psychological problems after 5, 6, 7 operations that had failed. So in 1971, I started the first comprehensive pain and stress management clinic. And over the years, I saw another 30,000 people, all of whom had failed conventional medicine. These are people who had had 1 to 52 unsuccessful operations, drugs up the kazoo, failed antidepressant drugs, etc.
Right.
And so in the early 70s, I started looking at what can we do for these people who have failed everything that medicine has to do. So I happened upon biofeedback training. I got into using biofeedback to help people control pain. I got into autogenic training and all the self-regulation tools. I already had started thinking about acupuncture. I started using acupuncture spontaneously and took training in it. And what I found was that essentially I think we can retrain the nervous system. It takes time. Basically, our best and most successful program, which will bring 85% of people out of depression and markedly reduce their pain, requires 2 full weeks of immersion therapy, 8 hours a day for 2 weeks. And nobody has done any better with these patients than 85%. In fact, very few people can get that much. We use a lot of electrical stimulation, especially transcranially. Back in the 75, I started using a device called LISS, L-I-S-S. Saul Liss, an engineer, brought it to me, and we found that it markedly improves or increases both serotonin and beta endorphin. And so using that alone, with nothing else, I can get 50% of people out of depression within 2 weeks. If I add to that photostimulation with something we call the RelaxMate, where they're looking at flashing lights at 1 to 7 cycles per second, that plus the LISS stimulator, we can get 85% of people out of depression safely within 2 weeks.
Right.
Now, if they don't then do the mental self-regulation exercises, the self-training, they have to continue using the electrical equipment. But if they'll do some exercises, which I first published in a book called 90 Days to Self-Health, they don't need that long term. Then about 15 years ago, I discovered on a visit to the Ukraine, they were using something they call microwave resonance therapy. This is applying the frequency of human DNA, which is 54 to 78 billion cycles per second, 54 to 78 gigahertz. They were applying it to specific acupuncture points, but it wasn't as specific as they seemed to think. They just looked for the most tender points and treated those generally. Now, about that time, I began to think in terms of systems in the body.
Mm-hmm.
The first system I wanted to work with was dehydroepiandrosterone, or DHEA, because low or deficient levels of DHEA are associated with every known disease, from depression to cancer and everything in between. And so I found that if I stimulate 12 very specific acupuncture points called the Ring of Fire, it will raise DHEA an average of 60% over whatever we start with. And if you stimulate other points, it will not raise DHEA. If you come back and stimulate only those 12 points, it will raise DHEA. So then we did clinical studies on what in Chinese cosmology would be fire diseases, migraine. 75% of people with migraine, marked improvement and decrease in their frequency and severity of headaches. Diabetic neuropathy, 80% of people with painful diabetic neuropathy, totally free of pain, marked improvement.
How long did it take for this improvement?
2 weeks.
Right.
2 weeks. We stimulate them. It takes about 21 minutes to do the treatment. And within 2 weeks, we have accomplished, what we can do. Now, they need to continue it. So for instance, somebody with diabetic neuropathy probably needs to continue for about 3 months, and then they might need to do it once a week. But I don't know anything that will help diabetic neuropathy as well as stimulating the ring of fire. Rheumatoid arthritis, 70% of women, well, most rheumatoid arthritis are women. I've had some men. 70% of people with rheumatoid arthritis who fail conventional medicine, marked improvement in their rheumatoid arthritis within 2 weeks. I had a 16-year-old juvenile diabetic in 2 weeks, totally asymptomatic. And, of course, depression. 70% of people with depression, we stimulate the ring of fire, they come out of depression just from stimulating the ring of fire with this particular stimulator that puts out 75 decibels of 54 to 78 billion cycles per second. So then I went to a circuit that balances aldosterone. And aldosterone, of course, can be out of balance in many disorders of the cardiovascular system, adrenals, kidneys, etc. And when we stimulate 13 specific points, we can bring aldosterone back to normal within 2 weeks. And that, of course, is good for congestive heart failure, among other things. Then I discovered a circuit which I call the ring of air, which puts one in a very interesting state of mind. It's very detached. I was just talking this morning with someone, we did it on yesterday, and he said, for the first time in my life, I was organized all day. I was able to focus my mind. And we found that this can increase a neurochemical called neurotensin, which is a neuroleptic, a normal neuroleptic produced by the brain. And we can increase neurotensin, over 100% within 20 to 30 minutes. And it'll last all day with you feeling, at peace, calm. So yesterday we actually finished an experiment for this week in which we have taken 10 new subjects and stimulated them electrically on these 21 points we call the ring of air, measured the oxytocin in their saliva and blood before and an hour after stimulation. On Monday and Friday, we did the same thing, but instead of using electrical stimulation, we applied to the 13 points of the ring of air a mixture of oils that I call Bliss, which I've been using for 15 years, and we measured saliva and and blood for oxytocin. It took about 2 weeks to get all the results. Oxytocin measurements are very tricky, but I've got a good lab to do it. But everybody I've tested it on, at least 1,000 people so far who've clinically tested it, feels within a minute or two of applying this particular mixture of special oils. One patient said, "Is this stuff legal?" And another one said, This has got street value, doc. And it makes you feel just totally delightfully relaxed and bliss. So I think this is one of the most important things I've done, because every known illness in general that has any kind of psychological thing is associated with deficiency in oxytocin. ADHD to autism to addiction, depression, even schizophrenia. They've been treating it with nasal sprays of oxytocin. But it looks to me as we can activate this circuit and treat every one of these problems possibly by stimulating the ring of air. And then there are a couple of other circuits. I've found one I call the ring of earth, which is 13 different acupuncture points, and this markedly increases calcitonin. Now, calcitonin is the strongest pain reliever the body produces. So it's phenomenal for helping people with chronic pain, but it also is good for putting calcium back into the bones, so for preventing and treating osteoporosis. Now there, we're talking about a 3-month treatment program to get it activated adequately, because most people with the osteoporosis, of course, have years in which they've been losing calcium and magnesium from the bones.
Mm-hmm.
And finally, there's a circuit with 13 other points, and these are very specific. If you don't stimulate the right points, you don't get the result. And we've done all kinds of studies showing that. But with the 13 points of the ring of crystal, we actually reduced free radicals 85% within 3 days. Now, they have to do it every day for 3 days. But by the end of the 3rd day, the free radical reduction in the urine, as measured by malondialdehyde, the byproduct of cell wall breakdown, is down 85%. And I don't know any food or any supplement that can do such a good job at reducing free radicals. And of course, free radicals are the key to stopping inflammation and degeneration and ultimately death.
Yes.
So if we look at all of these as a system, we have, I think, an electrically activatable and possibly volatile oil activated systems in the body, which can assist the patient, the individual, in normalizing DHEA, neurotensin, probably oxytocin, aldosterone, calcitonin, and free radicals. Now, what does all this have to do with health and spirituality? Well, I'm convinced that the problem with a huge majority of people is that they did not get adequately bonded at birth. And we know that if the mother during pregnancy had a major psychological traumatic event or more events, if the mother was put to sleep for the delivery, if the mother was induced with Pitocin, they literally do not put out oxytocin at the time the baby is born.
Uh-huh.
And so the child never bonds properly. And we look at the number of people who have some kind of dissociation, if you will, psychologically, some kind of social, psychosocial, psychospiritual problem. All of these people are deficient in oxytocin, and it leads to all kinds of spiritual and physiological stress illnesses. So the key to me is helping people get back into balance. And people can do that to some extent with a huge amount of self-regulation, using all kinds of psychotherapy, self-therapy. I've had patients who can do it just by following my mental, physical, spiritual exercises outlined in my book, 90 Days to Self-Health. But it's easier if they have a guide, if they have someone to teach them and keep them going. But if the bliss on the ring of air works as well as I believe it does, and clinically it certainly seems that way, I think we'll have a tool that will allow people more easily to reintegrate the physiology of the entire psyche and body. And of course, to me, if the oxytocin is actually there, and it correlates as well as it seems to with our clinical experiences, this will, I think, help more people than anything I've done to date.
This sounds really like a pretty major breakthrough you're on the edge of here, Norm.
Well, I honestly agree. Obviously, I'm hesitant until I get the blood test back on the oxytocin. You know, it's one thing to have people say, I feel blissed. There's another to show that it's created the chemical thing that we call love, the love hormone or the nurturing or bonding hormone. And to do that, and to be able to do that with a 30-second application of this particular mixture of essential oils is, of course, quite delightful.
So what would be the process to mainstream this into the general public? How would you mainstream this into the general public?
Well, you know, I was joking this morning with the gentleman I mentioned earlier that I talked with after his experience yesterday. I said, well, gosh, maybe we should start with it's better than street drugs, being facetious. And I don't want to get into that business. But honestly, I think it's going to be probably word of mouth. I do a lot of webinars, telephone interviews with lots of people listening. Spreading the word that way, of course, you know, I gave up. I have to say, personally, I gave up 30 or 40 years ago in changing the medical profession.
Okay.
Unfortunately, it's my opinion. The medical profession has been brainwashed and essentially put into perpetual enslavement by the pharmacomafia. And although drugs and surgery are useful about 15% of the time, 85% of the time, illnesses are the result of poor health habits. And they don't need drugs. It makes them worse. It causes complications. And so I don't see ever in the instant future, but the public is much smarter than physicians. And they recognize that excessive drugs are not a solution to most problems.
Yes.
In fact, you know, there are 4 major articles in major journals, including the England Journal of Medicine, stating that if all the negative studies on the antidepressant drugs had been allowed to be published, the net result would be 0 for antidepressant drugs. And certainly, having seen 30,000 people who failed antidepressant drugs, my impression is that they are one of the greatest scams ever perpetuated on the human race. Yeah, they help a few people, but they have more complications in the long run than they have true help. And since I can get 85% of people out of depression without drugs, you know, I just don't think antidepressant drugs have been a boon to the human race, even though they're one of the top 2 classes of drugs being sold. So, and then there's that other class of drugs, like the statin drugs, which I consider a plague on the human race, because you can lower cholesterol beautifully without a statin drug, without taking a risk of damaging your muscles or your nervous system.
Now, I think you'll find that many people agree, Norm, and I'm just wondering, given that what you're telling me sounds like standard knowledge these days, from your perspective, having come to your conclusion about the pharma mafia 20, 30 years ago, whatever, do you see this ever changing in the years ahead, or do you think it's a complete dead end forever?
Well, if you really want to know what I think right now, I think that within a year we'll be in the greatest depression the world has ever seen, financially, because nobody seems to be addressing the fact that the current so-called recession was initiated when it began to be obvious that the about 1.4 something quadrillion dollars of derivatives had blanketed the world. Now, when this first started several years ago, and I became aware of that, it was listed as the world's assessed value is about $1.25 quadrillion. So we have enough monopoly money all over the world. It isn't being acknowledged by the establishment. And sooner or later, that has to be wiped out in order to start over. So I see a worldwide serious depression, meaning
Yes.
money is going to be a major problem. And hopefully we will smarten up enough to cane in public square the people who originated derivatives, because I think that's the only solution for that kind of nonsense, and give them oxytocin afterwards. But I believe that as we reach a crisis in finances, that this is the time when people will really look to these natural, safe, and very inexpensive approaches. I can probably provide someone with a year's worth of bliss to activate their oxytocin or neurotensin system for $100. And if that has the health benefits, which I believe it will, that'll be a great boon in this particular crisis.
Would you think it goes beyond just being a mood lifter and alleviating health conditions? Could it actually be more constructive?
Well, the point is that high blood pressure, coronary artery disease, and cancer are stress illnesses.
Right.
And the stress illnesses are the combination, of course, of physical, emotional, mental stresses, probably some electromagnetic. But, I mean, even Sir William Osler, over 100 years ago, talked about stress as the cause of disease. And although most people are talking about emotional stress, obviously there are the chemical and physical stressors. So my hope is that as we introduce people to the point that they can feel good simply and safely, then they hopefully, when they begin to develop better self-esteem just because it feels good, they'll eat better and exercise more. This could change humanity rapidly.
Mm-hmm.
Basically, if people just would, we know right now the four top causes of premature death, and there was an article by this title within the last year, the causes of premature death, are obesity, smoking, not eating adequate amounts of fruits and vegetables, and inactivity. We know right now that if people just adopted those four habits, getting their weight under control, exercising, eating adequate fruits and vegetables, and not smoking, probably life expectancy within 2 decades could increase 20 to 30%.
Right.
And obviously disease would be decreased by about 80% or more. And so my hope is that by assisting people in feeling good about themselves and life in general, they'll adopt these habits better. Now, evolution is a slow process. And if everybody took up what I'm suggesting, for instance, right now, McDonald's and all the fast food restaurants would be out of business. I don't go to McDonald's. I took one bite in 1962, spit it out, and I've never been back. And I will never go to another one of those restaurants. If they all went bankrupt, that itself would be a horrible, immediate financial catastrophe.
Mm-hmm.
We'd have to evolve to something different.
Yes.
In the grocery stores, conservatively 60% of all the food sold is junk. I don't buy those things that have monosodium glutamate, processed this, that, or the other. Again, the entire food industry would have to change. And if I'm right, the need for drugs would decrease at least 80%. And so it's wonderful to think that this is what we need and where we need to go, and I hope and believe we will go there. But it's going to require a major financial overhaul of the system in order to support the concepts that I'm talking about.
So my next question then, Norm, would be, as far as your 1 year scenario, and a great many people would agree with that, particularly those in the current Occupy movement across the USA, which has now reached 500 plus cities, assuming that is the case, would the pressure that would represent imply that there is no money, therefore we have to take solutions from the alternative medicine cabinet, which offer far more bang for the buck, and we need to wake up and use them now? Or do you think that will imply that no, the vested interests will close ranks and be even more likely to try and gouge as much cash as they can?
Well, I think the evil empire, if you will, is certainly going to fight to the death to maintain control of the world. But I don't think they can win.
Right.
Ultimately, they have reached, I think, a peak of crime with the derivatives. That the final blow in their long-term criminal behavior was derivatives. And the derivatives are probably, other than nuclear contamination, the most stupid, risky thing that's ever been created. And they are going to bring us to our feet long before, unless somebody does something stupid, even more stupid, long before we have a nuclear crisis. So I really believe they'll lose. And they're going to lose just because the overwhelming truth is that they really exceeded the bounds when they created this paper mache called derivatives.
Right. And I think on that note, a great many people would agree and would see that they basically have now run out of steam. And so yes, what we're seeing is the petering out of the old to make way for the new. And in that scenario, it occurs to me that the role of the healers in our society is one of even greater responsibility, as the decayed ashes of the old are completely rendered redundant.
Well, all of that's very true, of course. And, there was a wonderful book back in the 70s by Dr. Whatley called How to Make $100,000 a Year on Farming 25 Acres. And I believe every city should be surrounded by 25 to 50 acre farms that are producing all the food. We can do that. It would take a few years to get it going, but it's possible. And we're going to have to do that in order to stop some of the nonsense, because, I live on a farm. I raise already 80% of all the vegetables that we eat. I could get by with what we can raise. I prefer to have a few things that I can't raise. I raise 70% of the fruits that I eat. I raise chickens. I'm about to add beefalo to our farm. And so I believe that most cities could be supported if all the farmland within 50 miles of them was used appropriately. And I think that's going to be part of the evolution that has to take place in the next few decades.
I think many, many people agree with that too. Okay then, well, I'm just keeping an eye on the time here. Can I suggest what we do is maybe come to those three questions that are being put to the speakers here. And the first question, Norm, would be, just in terms of rounding things off, is this. Looking back at your career, what for you are the three most important things that you've learned about healing?
Number one, attitude. An attitude, and the basic attitude has to be, I'm okay because God does not create junk. If one has that attitude, you can withstand almost everything.
Right.
Number two is to recognize that, in my opinion, the single greatest instinct is to help other people. And the only thing that interferes with that is when you don't feel good enough about yourself that you're craving nurturing that you never got. And you can actually learn to get that nurturing by giving and serving and helping other people.
Yep.
And number 3, in doing, essentially accomplishing the first 2, it means you also treat your own body as the holy temple which it is.
Right. That's great. Wonderful. The second question then is there any scientific evidence that you can point to that supports your answers there?
Oh, I think there's a great deal of scientific evidence for all of this in the psychological literature, in the physiological literature, and in the psychospiritual literature. There's a tremendous amount of support for all of this.
Is there anything on your site that I could pick up there, Norm?
Well, actually, of course, I've been producing a free email newsletter for the past 5 years, and the archives are all there. So I address most of these things one way or another, and each week I put out a new blurb of what I think the most important one. Probably about 2 weeks from next Wednesday, I'll have the big announcement about the Oxytocin outcome. But I think my email newsletters really cover my philosophy and commentaries on the whole concept of health quite adequately.
And so the third question is, what might the implications of this be for mainstreaming mind-body medicine and alternative therapies into the healthcare system?
Well, I think the implications are that we must use common sense, safety, and education to assist people in developing health habits and reclaiming their own health by finding a way to feel good about taking care of themselves. And I honestly believe most people don't get to that stage, unfortunately, at this time until they reach a crisis.
Yeah.
In other words, John Travis set up back in the 70s the first truly wellness center. And it went bankrupt because people were willing to pay for health until they lost it. So I think the implications are we in the mainstream of medical health care must emphasize to people the simplicity and the fact that they have the intrinsic ability to do this. And if we nurture them and help them nurture themselves, that's how it's going to develop.
Right. That's a very good point, isn't it? Human nature, if left to its own devices.
Well, nurturing is natural. I honestly believe that the driving guide for most people is a desire to help other people. And we get lost sometimes in all the stress and hurly-hurly stuff, but we need to get back to that.
Yeah, I would agree with that. Yes. Excellent. Well, thank you, Norm. That's been really good and educational. Is there anything else you'd like to add as we close?
Well, what I always say is, remember, every day is a good day. No matter what the weather is, no matter what else is happening, if you just look at the beauty of the world. And I'm sitting here in the middle of the Ozarks on the most gorgeous October day. But even if it was snowing or raining, it would still be a gorgeous day because nature is truly gorgeous and healing.
Wonderful. Well, thank you very much, Norm, for those wonderful words of wisdom. And I'm sure that will go down wonderfully with the audience in Perpignan next weekend. And I wish you all the very best.
Thank you. And let's see, when the meeting is actually week after next, isn't it?
It's a week today.
A week today. Well, I probably won't have the oxytocin results by then, but I'll let you know as soon as I get them.
Oh, that'd be very much appreciated. So you've got my email. Let's keep in touch on that. Thank you very much.
Indeed. Thank you so much. Have a great weekend.
And you, Norm. Thank you.